Hi, and welcome to the Eczema Podcast, where you'll learn tips, products, and natural eczema remedies from Abby, registered holistic nutritionist and founder of PrimePhysiqueNutrition.com. Here's your host of the Eczema Podcast, Abby.
Hi, everyone. Welcome to another episode of the Eczema Podcast, and thank you so much for tuning in today. Today, we have a wonderful guest you may have heard on previous episodes that we've had on the show before. Today, we have Dr. Peter Leo. You may have heard of him, and he was also recently one of the speakers at the National Eczema Expo as well that I attended back in June. And the wonderful thing about him is that during the conference, he actually received a recognition award from the CEO of the National Eczema Association. And he was recognized for his efforts and the great things that he's been doing. If you're not watching the video version of the podcast, you'll likely hear applauses in the background, and that's just a video of Dr. Peter Leo receiving his recognition award at the National Eczema Expo. He also serves as a member on the Scientific Advisory Board for the National Eczema Association. He's also a clinical assistant professor in the Department of Dermatology and Pediatrics at Northwestern University. He also co-founded the Chicago Integrative Eczema Center, and he's very passionate about combining Eastern medicine with Western medicine because he's also a medical acupuncturist as well. He received his degree from the Harvard Medical School, and he completed his internship at the Boston Children's Hospital and his dermatology training in Harvard. So he has a lot of expertise in the area of dermatology, and today we're going to be talking about treating baby and children eczema. Now, you'll find that in this podcast, he talks a lot about baby eczema, but a lot of the same treatments apply to children as well. So hopefully you can keep listening. And I just want to also give a big mention to the National Eczema Association because they have been doing a lot, and I just want to thank them for bringing the community together at the National Eczema Expo each year, and for providing a lot of materials like webinars and helpful information for people who are suffering from eczema. And they always accept donations to help spread and promote their cause as well. So if you want to learn more about them, visit nationaleczema.org. I also want to share that in addition to this podcast, if you want to learn more information about treating baby and children eczema, I actually just released a workshop which you can find on my website. And the workshop is all about baby and children eczema, and it features different speakers like a nutritionist and naturopaths and skin experts and product experts as well. You can find out more about the workshop at conquereczemaacademy.com/baby children eczema workshop. And if you can't find it, you can always head to PrimePhysiqueNutrition.com, which is my main page, and there will be a link to the workshop as well. I am so excited for today's podcast, and I hope that you'll be able to learn a lot and get a lot from it as well. So without further ado, here is today's speaker. Hi everyone, today I have Dr. Leo here, and we are going to talk about baby eczema and all things to do with eczema. That includes toddlers and perhaps even children as well. So thank you for being here today, Dr. Leo.
Thank you for having me.
So I am so curious to see how baby eczema works and how to treat it, because I know with adults there's so many more things that we can do, but I'm just curious as to how baby eczema works, and I'm just wondering if you can give us, I guess, a breakdown and a summary of things that you've seen in your clinic as well.
You know, it's really tough because when you look at all patients with atopic dermatitis, the vast majority of them are kids and babies, and that makes our life really tricky, especially because, for example, in the US, the FDA is now fast-tracking a few medicines for atopic derm, but they're for adults. So we know they're going to hopefully come down to pediatric levels soon, but might not be for a while. And then when we really limit it to the babies, we have almost nothing, because even things like tacrolimus and pimecrolimus are calcineurin inhibitors, the brand names Protopic and Elidel. They're not even approved for the babies. In the U.S., they're approved only down to age 2 years. Now, in Europe, they're approved down to 3 months of age, apparently, but in the U.S., that's not the case. So the babies really have everything stacked against them, and it's so unfair, because they often suffer the most. And they can't tell us that they're suffering. So it really, really stinks. We can't tell them that it's going to be okay. What do we do for them? Well, it is difficult because all of the same principles apply. We have to fix the skin barrier, support it as best we can when it's broken, and try to supplement it so it can heal. We have to make sure there's no bacteria on the skin, calming that down. We want to calm the inflammation, and we want to control the itch. And all of those things are much harder in babies because their skin is really delicate. Everything we put on there, they absorb at a much higher rate than more mature skin. And because their surface to volume ratio is so different than an adult, they're really, really tiny. So they have all this surface area and not much inside space. An adult, much more volume for that surface area. So we don't worry as much about side effects from things we put on the skin for an adult. But for a baby, we worry a lot. And then to top it all off, to make our life even harder, they're growing, and everything's sensitive and delicate. So brain development, skin development, actual physical growth, all these things can be damaged if we're not careful. So it's the most dangerous time to do anything, and yet they need us the most. So what do? All the same principles apply. We still really, unfortunately, need our topical corticosteroids, for better or for worse, because we know that's the one way we can cool down the inflammation. Before that, of course, we're doing things like good moisturization, good bathing to see if we can protect them. But for the kids who are more severe, we're going to need almost for sure the topical corticosteroids. Sometimes we're going to do things like wet wraps, which can be incredibly cooling and soothing, either with or without steroids. We also will do things like some of the cooling creams and ointments to soothe the skin. We don't really like a lot of the anti-itch creams, because many of those affect the nerves and can be absorbed. So we don't like to use those in the littlest babies, but we can do cooling creams. The other thing that we'll often do for them is oils on the skin, and we can do cooling and soothing baths. So lots of simpler approaches, but we max out really quickly. So for the severe cases, we are really limited. We really can't use light therapy in babies. The phototherapy is off the table. We can't use really any of our systemic medicines like cyclosporin or azathioprine or methotrexate, because it's just generally the risks are too high in a little one. So it becomes limited. And I'll tell you, my most difficult patients, the patients I worry about so much, are my little babies, maybe 6 months old, who are just suffering. Cheeks often bright red, oozing, crusting, weeping. Sometimes the scalp is involved too. They'll often have seborrheic dermatitis and eczema, and it's just terrible. So we're trying to get them comfortable. We don't want to cause side effects. The family's upset. Nobody's sleeping. And these are the tough cases that really, really challenge everyone.
So I know that we have covered in one of our other episodes about different types of baths for eczema. So in babies, can they do things like oatmeal baths, apple cider baths, bleach baths?
All the above, yes. And they all do slightly different things. For some of the babies, we really like the bleach because, again, it helps with a little bit of the bacterial colonization. We think there's some discussion that it might not be as good for the bacteria as we thought, but it seems to help. It definitely has that anti-itch and anti-inflammatory effect. Some babies that have this seborrheic dermatitis appearance too, with the scalp involvement, they may have a little bit of yeast overgrowth too. So for those babies, we can sometimes use dilute apple cider vinegar, and that has maybe a little bit more of an anti-yeast effect. And then we even like things like oils in the tub, or there are even some tar baths. There's some coal tar extract that can be used. Now, there often is a little skin cancer warning or cancer warning on those, but we feel that for the way that we use them, short periods, we're not going to leave them on the skin. We're going to wash them right off. The benefits seem to outweigh the risks, so we feel okay about that.
That's good to know. And then as for oils on babies, what are your favorite oils?
I love, again, my usual, my sunflower seed oil I really love. I love coconut oil. There are a lot of proprietary mixes too. I will say that there is a There's a newer oil that came out. I think Cetaphil markets it, but it was originally a German product. That's like an older German product that they brought over, and it has a number of different oils kind of mixed in, and it's actually really, really nice. Now there is I believe there's an almond oil extract in there, which makes me just a little nervous about nut allergy, but so far it seems to be really, really well tolerated, and the babies do great with it. So lots of different ones to use. Even jojoba oil is a wonderful wax. It's like a natural waxy oil that's really soothing on the skin.
That's great. Jojoba oil is a bit more expensive, but I know the quality is usually pretty good.
Mm-hmm.
And I'm just going to repeat this for people who don't listen to our other episode on pregnancy and eczema, but I saw an article where it said that sunflower oil weakens the barrier, but you were mentioning that the study is a bit skewed because the sample size was really small, and that you still see the effectiveness of sunflower seed oil in your patients as well. So
Absolutely.
Yeah, so that's something that I guess my listeners can keep in mind. But Dr. Leo, do you find that babies who have eczema usually outgrow it, or especially the really severe cases like you mentioned?
Yeah, so we think that about somewhere on the order of 50 to 80% of children will actually outgrow their eczema in time. It seems to be related to the severity. So the more severe the eczema is, the less likely they are to outgrow it. And the more mild it is, the more likely they are to outgrow it. So that makes things a little bit confusing. But for the most part, most of the kids will get at least significantly better. I don't ever tell the families that everyone's going to get better, because I have a group of adult patients who are pretty furious that they were told they're going to grow out of this, you're going to grow out of this. And I'm like, I'm 40 years old and I haven't grown out of it. But I think most people do get better over time.
That's really, I guess, comforting to hear that most of them will outgrow it, especially for parents who are worrying a lot.
Absolutely.
So in terms of treatment, are there any other types of treatments that you usually do, or for example, anything internal? For
the babies, the two things I really like for all of my patients to do, and this is a little bit controversial, but I really do like all the babies to be on a probiotic of some sort. I think that there's probably at least a group of kids who does better when they're on probiotics. So I think that's one thing that's nice. And there was a neat paper, or been a few papers that actually show that some probiotics, particularly the one lactobacillus types, they seem to be able to help leaky gut. And we know there's this funny leaky gut, leaky skin connection. And when they actually measure leaky gut, if you add probiotics, you can actually show some improvement. So probiotics, I think, are helpful, even though, agreed, there's controversy and it doesn't always help. And, I think many patients doesn't do a thing for, but I still think it's safe and a reasonable thing to try. The second thing is I like vitamin D. I have most of the babies go on extra vitamin D if they're not already. And again, controversial, but some kids seem to do better with it.
Someone was actually telling me today that they put vitamin D on topically on the wounds and the rashes, and it actually helped.
Interesting. That I've not heard of, so I don't know much about that, but that's very interesting. That probably would be neat to look into. Now, I'll tell you, we use some vitamin D analogs, particularly in psoriasis, so kind of molecules similar to vitamin D, and some of them have been studied in atopic dermatitis. Mixed picture. Sometimes it seems to help, but it can, in theory, topical vitamin D, in theory, can make things worse. So as weird as it sounds, oral seems good, topical may be worse, but there's not enough evidence. So that's interesting, and I'd be very curious to learn more about that, and that's neat.
Mm-hmm. But they did. They never figured out why some people get worse, right, when they use it topically.
It's a little confusing. There was a beautiful paper a few years ago, and it was talking about, that diaper cream. I don't know if you have it in Canada, but it's called A&D ointment. Do you know this?
I'm not sure.
It's like a diaper paste that has vitamin A and vitamin D, and it's been around for a long, long time. But the paper was called "Why Vitamin A and D Ointment Has the Two Worst Things for Eczema" or something like that. And the idea was that you can show that the vitamin A derivatives can actually be pro-inflammatory in this setting. They can make things worse with inflammation, and the vitamin D topically can make things worse. So interesting to think about this. And one of my favorite pearls, one of my teachers used to always say, so some people come in with just hand eczema that looks terrible. Their hands are a mess. And a lot of times we don't know if it's eczema or psoriasis. It can actually be confusing. So what we'll say is we'll call it hand dermatitis. We don't know which one it is, and we want to figure out what it is. So maybe we can do a skin biopsy. Sometimes that can help. Maybe we'll do something like patch testing to see if there's an allergen driving it, or we'll, of course, check the rest of their body. But one of his favorite tests was to put vitamin D topically on there. And he said if it got better, it's psoriasis. If it flares up, it's eczema.
Oh, interesting.
Kind of a neat little pearl. But it was a vitamin D analog. It wasn't pure vitamin D. So.
And we will be back after this quick announcement. For over a decade, I was plagued by extremely severe eczema. And during that time, I tried more healing products than I can remember. As my eczema began to heal, I set out to create the Conqueror Soothing Dry Skin Balm. No harsh preservatives or ingredients are needed to prevent bacteria from developing, making it safe, gentle, and 100% natural.
Visit the store page on primephysiquenutrition.com to learn more about it.
And now we're back. What do you think about people who want to take their baby for allergy tests or blood tests? Does that actually help anything?
So I think it's not a bad idea, and as we're learning more about like the role of food allergies in this, so historically we felt, you've heard people sort of talk about this, they say, okay, food is driving this, right? You eating something that's making your skin bad. So we got to figure out what you're eating that's making your skin bad. But now we're turning everything upside down. It turns out that this is probably largely wrong and literally backwards, that the leaky skin and leaky gut, these two together, because right, if we follow our skin around, that becomes our gut. It's all the same epithelium. That leakiness is allowing allergens, some of which are food allergens, to enter in an abnormal way, and the immune system is freaking out about those things. So we know in a mouse model, we can sensitize a mouse to a food through their skin. You keep if you irritate the skin and put food on it over and over, then you feed them the food, they will have allergy. So the role of the allergist isn't, in my opinion, to just try to find a food that's triggering it, which again, in my biased experience, is not often the case or rarely the case. In fact, when it is, we all do a dance. It's like if strawberries are your answer, it's like, let me take it to the extreme. If one or two foods are causing your eczema, you don't have eczema. You have an eczematous food allergy. You don't belong with me. This is not what we're talking about with our eczema patients. You literally are a different disease. It'd be like someone saying, well, my foot pain got better when I pulled out my splinter. What's wrong with all of you people who have some broken bone? You know, it's like, well, this is actually a different thing. Like, this is a broken bone. These people have ankle pain because you had a splinter. This is not the same. It doesn't make any sense for you to tell the people with a broken foot to say, try to pull a splinter out. It's crazy. It doesn't make any sense. So same thing in this situation where it's really a different disease. But what we want the allergist to do is check to see what you're allergic for so far. And if you're not allergic to things, we want you to be exposed to those, because the big paper that came out last year called the LEAP study suggested that kids who get early exposure to peanuts may not develop peanut allergy. And this is a huge, huge thing, right? Because I have a kid who's peanut allergic, and I hate it because we're always on pins and needles. And we learned the hard way. She had a peanut M&M, and bam, face blew up, vomiting, and a whole mess. So now we have to be ultra careful. But if we could prevent that, that would be incredible.
Yeah, I have heard about that same study that you talked about, where if you introduce those allergenic foods earlier, it actually might help in preventing those allergies in the future, which is interesting.
Isn't that cool? But we just need to know, because if you just feed somebody a peanut hoping that they're not allergic, it's pretty dangerous. So ideally, the allergist will help us, take us through that. They'll test to see what you're allergic for, and they'll say, okay, you're okay to go ahead and do this. And so that's what I like it for, but not so much for try to find things that are triggering.
So if a baby is like, let's say like 3 months, 4 months old, does it still make sense to see an allergist if they're not really eating solid foods yet?
I think it could. Because usually you're getting ready, your anticipation for it. So I don't think every kid, of course, but kids with either a strong family history of food allergies or atopic dermatitis, or kids with pretty bad, I would say moderate or severe atopic dermatitis. I do like those kids. And if you have a little bit of eczema on your arms or something, I'm not too worried, or a tiny bit of facial. I think you don't really have to waste your time and energy, because it is expensive. Again, personal experience with our daughter, our insurance paid for a portion of the visit, but the testing was something like $800. It came back. A lot. The testing. It was like, oh my gosh. So, I'm obviously in the medical profession. I did not expect that kind of a bill as a leftover. So it's not a cheap thing, and sort of just reinforced what we knew. We knew the peanuts. We learned the hard way. So, being cost effective and being smart about it.
That's good. Are there any other treatments for babies that we haven't covered yet that might help?
What else for the babies? Breast milk. Some people have talked about actually putting breast milk on the skin. I do not think that is crazy.
I've heard about that.
Yeah, I don't think that would hurt. It's not a cure-all. It's not magic, but I think it can be good. We talked a little bit about moisturizers, and one of the most exciting stories that came out the last couple of years and is still developing is that by moisturizing high-risk babies, we can potentially prevent eczema. So we just wrote a paper, it just came out in JAMA Pediatrics just this week, where we talked about the economic impact of this. To just take a baby who's at high risk, we know it cuts the development by about 50% if you just use a moisturizer. So you could use plain petroleum jelly, it's like a nickel an application or less, and they cut the development of eczema by about 50%. And so the savings to the system and the savings emotionally, the quality of life savings it's incalculable. It's gigantic.
Wow, that's amazing. So my other question is, if you're treating babies, like we have to treat them so carefully, and I was wondering, like, let's say when they grow to toddlers or children, how does that work? Are we more, I guess, we have more options for treatment, or do we treat them differently?
I think the foundation of the treatment is really the same at any age, and we really try to use as little medicine as we can. The less, the better. So if I can just get by with moisturizers and cooling wraps, I'm happy. If we can use light therapy instead of cortisones, I'm happy. If we are suffering and we're getting infections and then we need to go on something more, then I think we escalate. But yes, as they get a bit older, now once we're 3, 4, and 5, unfortunately, I even have kids that age who have to be on cyclosporin for a little bit, this powerful immunosuppression. I hate it. I don't want them on it, but these are kids who are literally going in the hospital time and time again. They look like a burn patient. Everything's open, bleeding, infected. They're not sleeping. The parents are falling apart. They've used way too much steroids already. So it's like, we can't keep doing this. So we need to break cycle. And for those patients who use a more powerful medicine for a brief bit, get the immune system back under control, let the skin deeply heal, let them sleep properly again, because behaviorally and developmentally, this takes an enormous toll on the more severe patients. But even in the mild to moderate kids, they're scratching, they're ants in the pants, they're uncomfortable. And I often say, if you've ever had, an itchy spot or a poison ivy, you can't concentrate. Your whole day is screwed up. You're paying attention to that instead of what's going on. And so for a 3, 4, 5-year-old, this is an important time. They're acquiring language. They're learning about the world. And if they're totally preoccupied with this and not sleeping, that's bad.
Yeah, I completely agree with that. That's you have some really hard and challenging cases that you see.
Definitely.
Is there anything that we can do for the parents in terms of support, especially with what they're going through?
Seeking a support group can be wonderful. We have one of the National Eczema Association support groups in Chicago. They're all over, and doing something like that is wonderful for the whole family. I think you got to reach out for other parents and families to get some support. Things like hypnosis, meditation, acupuncture, any kind of relaxation stuff, yoga, all of those can be really helpful for the whole family. There was also a really neat paper that showed baby massage helps both the babies and the parents. So the parents can do baby massage, yeah. And usually I say, do it with like one of our natural oils. Like you could do it with our coconut oil, or you could do it with our sunflower oil. And then you do that and it kind of calms everybody down and it's good for everybody. So that's kind of nice too.
That's really, really great to hear. Thanks, Dr. Leo. In terms of, I guess, closing, do you have any last words of advice, or I guess maybe anything we left out in terms of treatment that you might want to mention?
The good news is there are some new treatments coming down the line. And even though I think it's been a bit disappointing so far with what the medical establishment has had to offer, a lot of patients are frustrated. It's like the same old thing. You hear that over and over online. They just gave me the same stupid steroid. They did the same stupid thing. And honestly, I feel like I do a lot of the same stupid stuff. I don't have that many things in my armamentarium. But there is tremendous developments happening right now. So we have a bunch of new medicines in the pipeline for the first time ever, and we're all like giddy with excitement that we finally have new options, mostly for adults, it's true, but even for littler kids. And then presumably over time, we'll even be able to see what is really safe, what is really effective. Can we use some of these in babies who require it? But even better, what if we learn how to prevent it? So I think we're going to do that hopefully in the next 5 or 10 years. We're going to have better knowledge than ever about how to prevent and minimize it, which would be better than any of this other stuff.
Yeah, that would be so great because even among my friends, like I've never seen so many babies with eczema. Like it seems like it's just a really like rapidly increasing. I don't know if it's an epidemic or not, but it just seems like a lot of my friends' babies have it.
It's pretty intense. I mean, we've seen just so many kids with it, and the numbers are somewhere on the order of like 15%, maybe as high as 20% of children will have some amount of it, and that kind of includes everybody. But it's still a lot of kids who suffer a lot.
Mm-hmm. Yeah, and that's hard. But hopefully, some of the treatments you mentioned today will be able to help some of the parents out there who are watching. So thank you so much. Do you have a website where people can find out more information about your clinic or where you practice?
Yes, please check out our website. We're the Chicago Integrative Eczema Center. It's chicagoeczema.com.
Thank you so much, Dr. Leo.
Have a good night.
You too.
Thanks for listening to the Eczema Podcast, and stay tuned for our next episode. If you like what you just heard, we hope you'll pass it along to your friends and colleagues. Visit primephysiquenutrition.com for more articles and tips. Thanks for listening.